over 60, these 9 medications could be speeding up memory loss. What if I told you that one of the biggest threats to your memory may not be aging at all? What if the real reason you're forgetting names, losing your train of thought, or walking into a room and forgetting why you're there is sitting inside your medicine cabinet right now? Before we begin, take a moment to subscribe to the channel and turn on notifications. Every week I share practical health information designed specifically for adults over 60 who want to stay mentally sharp, independent, and healthy for as long as possible. And while you're down there, tell me in the comments your age and how many medications you take every day. I read as many comments as I can, and your experiences often inspire future videos. Now let's get started. Every year, millions of older adults are told they are experiencing cognitive decline. Many assume it's simply part of getting older. But after decades of caring for seniors, I've learned something surprising. Sometimes the problem isn't age. Sometimes it's medication. Today, I'm going to walk you through 9 medications and medication combinations that geriatric specialists often review when investigating memory problems in older adults. This does not mean these medications are dangerous for everyone, and it absolutely does not mean you should stop taking anything without medical supervision. But it does mean you should know what questions to ask and what warning signs to watch for. Stay with me until the end because the number 1 item on this list isn't a single medication at all. It's a hidden problem affecting millions of seniors, and it may be one of the most overlooked contributors to medication-related memory decline. Let's begin. First on our list is a medication so common that many people no longer think of it as a medication. They think of it as a sleep aid, an allergy remedy, a harmless little pill they can buy at any pharmacy. I'm talking about diphenhydramine, commonly known as Benadryl. Many seniors take it to help them sleep. Others use it for seasonal allergies or cold symptoms. The problem is that this medication belongs to a group called anticholinergics. As we age, the brain becomes increasingly sensitive to medications that interfere with acetylcholine, a chemical messenger involved in memory formation, learning, and attention. Imagine trying to have a conversation while someone keeps turning down the volume. Messages still get through, but not as clearly. Over time, that reduced communication may contribute to confusion, forgetfulness, and mental fog. I've had patients who spent years blaming themselves for memory problems only to discover that a medication they took every night was part of the picture. The most concerning part is that these changes often happen slowly. They don't occur overnight. They creep in gradually until people assume it's simply aging. That's why every medication review should include over-the-counter products, not just prescriptions. Next, let's talk about heartburn medications. Millions of people rely on medications like omeprazole and esomeprazole to control acid reflux. These medications can be incredibly effective. They help people eat comfortably, sleep better, and avoid painful symptoms. But many individuals remain on them for years without ever revisiting whether they're still necessary. One concern associated with long-term use is the potential reduction in vitamin B12 absorption. Vitamin B12 is essential for healthy nerves and proper brain function. Low levels can sometimes contribute to fatigue, poor concentration, mood changes, and memory difficulties. The challenge is that these symptoms often resemble normal aging. Someone may assume they're simply getting older when, in reality, a nutrient deficiency could be contributing to the problem. This is why periodic reassessment is so important. The question isn't whether the medication is good or bad. The question is whether it's still the right medication at the right dose for the right person. Now let's discuss a topic many seniors hesitate to talk about: bladder control problems. Frequent bathroom trips, urgency, and fear of accidents can dramatically affect quality of life. That's why medications for overactive bladder are so commonly prescribed. Some of the older medications used for bladder symptoms work by affecting the same brain chemical systems involved in memory and concentration. While they may help control bladder symptoms, they may also contribute to cognitive side effects in some older adults. I once spoke with a woman who believed she was developing early dementia. She had become increasingly forgetful over several years. She misplaced items, forgot appointments, and struggled to stay focused during conversations. When we reviewed her medication list, we discovered several medications that could potentially contribute to cognitive symptoms. Again, this didn't prove the medications were solely responsible, but it reminded us how important it is to evaluate the entire picture. The body doesn't work in isolated compartments. Everything is connected. And that brings us to another category of medication that may surprise you because it is prescribed to millions of people every day. Cholesterol-lowering medications known as statins. Let me be very clear. Statins save lives. For many individuals, they dramatically reduce the risk of heart attack and stroke. This is not an argument against statins. However, some patients report experiencing memory changes, confusion, or mental fog after starting certain cholesterol medications. Researchers have studied this question extensively and the findings have been mixed. Some studies find little evidence of significant cognitive effects, while others suggest that certain individuals may be more sensitive than others. What matters most is recognizing changes and discussing them with your healthcare provider. If you've noticed new memory issues after starting any medication, keep track of those symptoms. Write them down. Patterns often reveal important clues. The goal isn't to stop treatment. The goal is to make informed decisions that protect both heart health and brain health. Now we're about to enter the top 5, and what comes next involves medications that many people take for anxiety and sleep. Unfortunately, these medications may create a hidden trap that becomes more difficult to escape the longer they're used. Now let's continue with the top 5. These medications are among the most commonly prescribed treatments for anxiety, panic attacks, and insomnia. At first, they can feel life-changing. For someone struggling to sleep or dealing with overwhelming anxiety, the relief can feel almost immediate. The racing thoughts slow down. Sleep finally comes. The constant tension begins to fade. But what many people don't realize is that some medications in this category can become much more challenging over time. I've had countless patients tell me the same story. They started taking the medication during a stressful period of life. Maybe it was after retirement, after losing a spouse, or during a difficult health crisis. The medication helped, and because it helped, they continued taking it. Months turned into years. Then one day they noticed they didn't feel as mentally sharp as they once did. They felt slower, less focused, more forgetful. The difficult part is that these changes often happen gradually. Many people don't connect them to a medication they've been taking for years. Instead, they blame age. They blame stress. They blame themselves. If you're currently taking medication for anxiety or sleep, the important message isn't fear. It's awareness. Never stop these medications suddenly without medical supervision. Instead, have an honest conversation with your healthcare provider about whether your current treatment plan still makes sense for where you are today. Now let's move to number 4, and this one surprises many people because it isn't always prescribed for depression. In fact, many older adults receive it for chronic pain, migraines, nerve pain, or sleep problems. I'm talking about older antidepressants such as amitriptyline. These medications have been around for decades and can be effective for certain conditions. However, some of them also have strong anticholinergic properties. Remember the chemical we discussed earlier called acetylcholine? The one involved in memory, learning, and concentration. When multiple medications affect this system, the cumulative impact may become significant. This is why medication reviews become increasingly important as we age. A medication that made perfect sense at age 50 may deserve reevaluation at age 75. Our bodies change. Our brains change. Our needs change. The best healthcare decisions evolve along with us. And now we arrive at number 3, the medication I told you to watch carefully. This one is especially important because many people assume all antidepressants work exactly the same way. They don't. Some antidepressants have different side effect profiles than others, and certain medications may be less suitable for older adults. One example is paroxetine. While it can be effective for depression and anxiety, geriatric specialists often pay close attention to its use in seniors because of its anticholinergic effects. This doesn't mean it's automatically inappropriate. It means the risks and benefits deserve careful consideration. The most important lesson here is that not all medications within the same category are identical. If you're experiencing memory concerns, don't simply ask whether you need treatment. Ask whether there might be another option that better fits your current stage of life. Sometimes a small adjustment can make a meaningful difference. Now we're down to the final two, and what comes next is something that many families never realize is happening. Number 2 isn't just about a medication. It's about a situation that often develops quietly over time. Certain medications originally designed for serious psychiatric conditions are sometimes prescribed to older adults for agitation, sleep difficulties, or behavioral symptoms. In some situations, these medications may be appropriate. In others, they deserve careful reassessment. What concerns me most is when a medication remains on a person's list for years without anyone revisiting the reason it was started. I've met families who believed a loved one's decline was simply inevitable. Then we sat down and carefully reviewed every medication, every supplement, and every over-the-counter product. Sometimes the medication list had grown so large that no one had looked at the entire picture in years. That's why medication reviews are among the most powerful tools available in senior healthcare. They help identify unnecessary medications, duplicate treatments, and combinations that may no longer be serving the patient well. And now we've reached number 1. This is the most important point in today's entire video. The greatest threat isn't usually a single medication. It's the combined effect of multiple medications working together in ways nobody notices. This is known as medication burden. More specifically, anticholinergic burden when several medications with anticholinergic effects are taken at the same time. Imagine one medication reducing memory-related brain signals by a small amount. Perhaps the effect is barely noticeable. Then add another medication with similar effects. Then another. Then another. Individually, each medication may seem harmless. Together, the cumulative impact may become much larger than anyone expected. This is where many seniors get into trouble. A sleep aid, an allergy medication, a bladder medication, a pain medication, each prescribed or purchased for a valid reason. Yet nobody ever calculates their combined effect on the brain. Over time, the result may be increasing brain fog, slower thinking, difficulty concentrating, memory problems, and reduced mental sharpness. The encouraging news is that medication-related cognitive problems are often more manageable than many people realize. When identified early, some individuals experience noticeable improvement after working with their healthcare team to simplify medications, reduce unnecessary treatments, or switch to safer alternatives. That's why today's video isn't about fear. It's about empowerment. You don't need to panic. You don't need to throw away your medications. And you absolutely should not stop medications on your own. Instead, schedule a medication review. Bring every prescription. Bring every over-the-counter medication. Bring every vitamin and supplement. Then ask one simple question. Do all of these medications still make sense together? That single conversation could be one of the most important health decisions you make this year. Before you leave, I want to hear from you. How many medications are you currently taking each day? Which medication on today's list surprised you the most? Have you ever experienced brain fog, forgetfulness, or memory changes that seem to appear after starting a new medication? Share your experience in the comments below because your story may help someone else recognize a warning sign they never connected before. And if you found this video helpful, please subscribe, like this video, and share it with a friend or family member over 60. Together we can help more people protect their memory, maintain their independence, and stay informed about the choices that affect their health. And one more thing before you go. Your medications aren't the only place your body hides important warning signs. Some of the earliest clues about your health may be visible right now at the tips of your fingers. In our next video, I'll reveal several nail changes that could provide important insights into your circulation, nutrient status, and overall health. Most people never notice them until it's too late. You won't want to miss that. Until then, stay healthy, stay informed, stay sharp, and I'll see you in the next video.